Does helping help or hinder health? I'm sure you've heard of karma. You know, the idea that what goes around comes around. What we were wanting to do with this study is find out whether this karma exists in the workplace or not. So if you help someone else, will this come back around and help you out yourself? But rather than just looking at whether helping others means you get more help yourself, what interested me was whether helping others would help you in terms of health. For instance, would helping others increase or possibly decrease your psychological health? Why would we want to know this? We would want to know this because people who have better health may be less likely to have sick days. They may be happier in their workplace and in general be happier, healthy people. This means that organisations may be able to do the thing they want to do the most, save money. Because if someone calls in sick, this means that productivity may be lost, or a temporary replacement staff member may have to be called in and trained up, or other employees would have to cover the sick person's work and also their own. All of these things would cost money. So by having healthier employees, organisations can save money and employees can be healthy and happy. In other words, everybody wins. So what exactly are we doing? We are trying to find out if there is a correlation between general psychological health and also helping behaviours in the workplace. So if you are the kind of person who goes around and helps everyone else you work with, will you have better general psychological health than the person in the same situation as you, but who doesn't help anyone else? So, what exactly is a correlation? Correlation means that you can use one thing, in this case helping behaviours, to predict the occurrence of another thing, general health. But be warned, it does not mean that one thing causes another. It means that you can use it as a tool to predict another thing. For instance, did you know that in the United States, ice cream sales are correlated to crime? So when ice cream sales increase, so does crime. But does this mean that ice cream sales cause crime? No, not necessarily. It just means that it can be used to predict the approximate numbers. There could also be another thing that influences the correlation, such as temperature influencing the number of ice cream sales, and higher gun sales influencing higher crime rates. So basically, a correlation is used to predict the outcome of something else, not what causes something. So what has been done in the past? A lot of work has been done to see whether there is a link between health of employees and negative types of work behaviour, such as bullying and stress, where the more of these negative behaviours that occur, the worse the health of the employees is. Other research has shown that there is a connection between bad conditions in the workplace, such as a lot of stress and conflicting demands by managers, reduces the chance of employees being good work citizens. So you will assume that there must be some connection between these two studies, where positive working behaviours can predict health. In other words, being a good citizen in your place of work, by helping others, should increase your health and in a way show that karma really does work. So how do we work out if helping is correlated to health? How we worked this out was by asking a whole lot of people, 748 to be specific, from a whole lot of different organisations to fill out a survey. This survey asked a wide range of questions, not just ones relating to health and helping behaviours, but also things like how employees perceived justice was being undertaken in their workplace, whether employees had good satisfaction with their jobs, and also a few basic questions concerning their employment, such as how long they had worked, pay rates, and whether they believed they would be leaving to work in another country anytime soon. Once the employees had finished answering the surveys, we collected all the data and organised it according to what questions related to what kind of things we were looking at. The survey answers that we were looking at for this study were helping behaviours and also the general health questionnaire. So what did we find? After sifting through a whole lot of numbers and statistics, we found that helping has a strong negative correlation with general health, which in English means that when helping behaviours increase, scores for general health decreases. This may sound bad, but it means that the more you help someone, the better your psychological health is. This is because high scores in general health means that you have worse psychological health than someone with a lower score. So think of it as meaning the higher you score, the more health problems you have. We also found that helping behaviour was regressed on general health. Helping significantly accounted for 0.06% of the variance in scores for general health. This basically means that only 0.06% of general health can be accounted for by helping behaviours. This means that there is some other factor or factors which are affecting general health. All the results are significant, which means that they aren't occurring simply by chance. So what can we do with this information? We can use this information to make individuals' workplaces better and by increasing the health of the employee. So if we found an organisation where people had pretty poor general psychological health, we would be able to increase this by getting the employees to help each other out more. Also, it has been shown in other studies that the better health someone has, the greater their motivation to work is. So if we can increase health by increasing helping behaviours, then we can make people more motivated to work. This in turn may make the organisation function better as a whole, because if you are healthy, then chances are you are a lot happier. The big question is, can we use this for everyone and everything? In some cases, yes, but you do need to be careful when using any type of data or theories. One reason to be careful is because the data that was used was collected from lots of different organisations, from lots of different sectors, not just one. So this may make it good for comparing general ideas, but maybe not specific ones. For instance, it's pretty hard to compare the scores of general health for people who work at flower stores with the general health scores for people who work in the army. It is pretty difficult to compare, as people who work in flower stores spend their time inside making pretty flower arrangements, while people in the army may be working with guns. Flowers and guns. Pretty hard to compare the two. So maybe by doing research in the future for certain types of organisations may make it easier to compare different organisations with one another. But by looking at a broad range of organisations, you can get a rough idea for what it is that you could expect to see. Another thing to take care about when looking at the information found in this study is to take into consideration that the data has been collected from organisations in New Zealand. This means that it may be easier to compare the data to Western countries, such as America, Australia or England, but on the other hand, it may be difficult to compare the data to non-Western countries, such as Taiwan, Iran, India or Kazakhstan. So if you are wanting to compare the results with other countries to see whether New Zealand is pretty unique or just following the trends, then you may want to take the surveys and distribute them around the globe, maybe changing the questions to the right language and more culture specific. Then you would be able to compare the data a bit easier and a bit more reliably. So if you weren't paying attention in the last few minutes, or if you just want to know what the heck I'm talking about, basically you can predict the health of people by those who have higher scores in helping. So those people who help more have better general psychological health. This links previous studies which indicate links between negative work behaviours and health, and also negative work conditions and demonstrating good citizenship type behaviour in the workplace. In the workplace, this means that to increase either the general psychological health of employees or the willingness of the employees to help each other, you must increase the other one.